Okay. Unless anyone has an objection, I'm going to record this so that we've got it available for people to see at a different time. If you have a question, you're going to put it in the chat, so you're not going to be identified on this recording. Okay, Jerry, can you hear me okay? Okay. So Anna already stole some of my thunder, but licensed coming up on 39 years, or just hit 39 years. And I'm a member of the National Association of Benefits and Insurance Professionals. So that's my professional organization. I'm a professional health insurance agent, and I'm also on the Medicare Advisory Group, which is a group that's looking at helping clients, helping people, and solving some of the problems that we have with Medicare on a national level. Okay, best insurance agent, voted 22 years in a row, recognized by the San Fernando Valley Business Journal as a trusted advisor. And again, the new name of the organization is the National Association of Benefits and Insurance Professionals. Jerry Fisher is joining on the line. He's been working with me since 2016, and he will be looking at the chat for any questions you have. And he is my in-house expert on Part D prescription drug plans. I'm so happy that he's available, because otherwise I'd get stuck doing all those really complex cases. There's a new disclaimer that I'm supposed to advise you of anytime I'm talking to anyone, and I've got to read part of it. We do not offer every Medicare Advantage plan available in your area. For Los Angeles, we represent 8 organizations which offer 62 products in your area. Please contact Medicare.gov, 1-800-Medicare, or your local state health insurance program to get information on all of your options. Medicare.gov presently shows 116 plans available, some of which don't allow agents to represent them. We do not offer every Medicare Part D plan available in Los Angeles. We currently represent 7 organizations which offer 19 products. Please contact Medicare.gov or your local SHIP office to get information on all of your options. Medicare.gov presently shows 23 plans available, some of which don't allow agents to represent them. But when we're shopping Part D, we actually look at all 23 plans. And the carriers that we presently represent are Anthem, Blue Cross, Blue Shield of California, WellCare, Aetna, Cigna, Humana, United Healthcare, Scan Health Plan, and for Part D and our Medicare Advantage plans. Okay, if you know someone that couldn't make this session, there's going to be, hopefully I'm going to record this and post it to the website later today, but I've got 2 other sessions coming up on November 28th and December 6th. This is a screenshot of Facey's, the providers that they are currently contracted with for Medicare Advantage plan, and that's Anthem, Blue Shield, Clever Care, Humana, Scan, United Healthcare, and WellCare by HealthNet. So we find that everyone we talk to that's new to Medicare has just very much fear and uncertainty and confusion about how they get from point A to point B. And that's what we are experts at, is helping people make that transition onto Medicare. We really know the nuts and bolts of Medicare. So we don't do any other insurance. We don't do anything other than Medicare Supplement, Medicare Advantage, and Part D prescription drug plans. So we really know this stuff inside and out. I joke around here. Some people point out that we do have a few loose screws. So we do have a sense of humor. We don't take ourselves too seriously. If you have questions, Jared will be watching. He'll interrupt me if necessary, if there's something that is really confusing that I just said. But otherwise, he'll answer it in the chat. And if you have a very personal question on your particular circumstance, the best is to call my office and schedule a 15-minute consultation to help figure things out. So going through some basics first. So if some of you have been on Medicare for a while, I apologize, but I want to make sure that I touch base on some of these. So Medicare is the federal health insurance program. It's run by CMS, the Centers for Medicaid and Medicare Services, and it's part of the U.S. Department of Health and Human Services. You qualify for Medicare if you're 65 years or older, and if you're under age 65 and have certain disabilities or have been on disability for more than 2 years. You need to be a citizen of the United States or a legal resident for at least 5 consecutive years. So Medicare Part A mostly covers hospital, skilled nursing, hospice care, and home health care. For most people, there's no cost for Part A. If you've paid taxes into the U.S. economy for at least 10 years, then you have a 0 premium. If you haven't paid taxes or you're new to this country, your cost to purchase it is $505 a month. Medicare Part B covers doctor visits, lab work, tests, x-rays, chemotherapy, radiation therapy, durable medical equipment, ambulance rides, a whole slew of things. The cost is based on income. Starting in 2024, most people are going to be paying $174.70 a month. And if you're receiving Social Security benefits, it's automatically deducted from your check. In 2024, the Part B deductible is increasing from $226 to $240. So I show this slide because lots of times I talk to people and they're very surprised at how much Medicare costs them. So there's an income component for Medicare. And you can see over here, if you have an individual return or joint tax return, if you're under $206,000, then you're going to pay the minimal or nominal amount. But if it's more than $206,000, and that's modified adjusted gross income, there's always a 2-year look back. So starting in January of 24, they're going to be looking at your income for 2022. And you can see it can go up to quite a high level based on income. And this is per person. Lots of times I'll get a call from someone who's working for a company, they're a high paid executive, and they're thinking about coming off the group plan. And once I show them this chart, they decide to stay on the group plan. So if you think you're paying too much for Medicare Part B and the income related monthly adjustment amount, there's a form, of course, government form to fill out. You send in SSA 44. You have to check off one of the 8 specific boxes, marriage, divorce, death of a spouse, work stoppage, work reduction, and then project that your income going forward is going to fall under one of those thresholds. And I've had great success with clients that mostly it's people that have retired. And their income shows much higher 2 years prior, but going forward, they're not going to have as much. So they are able to reduce your Part B premium. Who needs to enroll in Medicare? So if you're under age 65 and on Social Security disability for more than 24 months, you'll automatically get enrolled in Medicare. If you're turning 65 and have no other health coverage, you definitely need to enroll. And if you're on an individual health plan, like through Covered California, and you're turning 65, you need to enroll in Medicare. Some people think, well, I'm on Covered California and it's costing me less than you're telling me it's going to cost me on Medicare. Well, once you become eligible for Medicare, you lose the subsidy under Covered California. And I'm not sure if they're notifying people on a timely basis, but for a long time they weren't. And people got a surprise when they did their taxes in April and discovered they owed thousands of dollars back on subsidy that they were no longer eligible for. Also, if you're on a group health plan and there are fewer than 20 employees, you need to get Medicare, because at that size group, Medicare is considered primary, the group is secondary. If you don't enroll when you're supposed to, then you have a general enrollment period, January 1st to March 31st, and you'll incur a 10% penalty on your Part B premium for every year you missed signing up where you should have. Now, if you stay on a group plan, then that penalty is not assessed. You don't get subject to that. Initial enrollment period is the 3 months before you turn 65, the month you turn 65, and the 3 months after 65. So who doesn't need to enroll in Medicare? And I get at least 1 or 2 calls a week from people that think they need to sign up on Medicare. And if you're in a group health plan, first thing you want to do is determine if there are more than 20 employees. And second thing is to see if the prescription drug coverage is considered to be creditable for Part D. Every year, the insurance carrier is required to send out notices telling you whether their plan is creditable or not. So if it's more than 20 employees and it's creditable and there's not much cost for the group plan and you're able to see the doctors you want and the out-of-pocket cost isn't too bad, you should stay on the group plan as long as possible. And some people mistakenly enroll in Part B and it's just a complete waste of money. So I tell people on a group plan, more than 20 employees, you don't need to enroll in Part B as in boy. So stay on the group plan, go off the group plan. It's mostly a math problem. How much it's costing to be on the group plan. I always ask, what's the out-of-pocket maximum on the group plan? And sometimes group plans have $10,000, $15,000, $20,000 out-of-pocket maximum, and that's kind of scary. Group health costs, you generally deduct on a pre-tax basis. Medicare costs are after tax. So if the group size is more than 20 employees, most of the time I suggest people staying on the group plan, but there are some exceptions. It's prudent to talk to someone like me when you turn 65 to see which is the better way to go. Okay, so there are special enrollment periods for Medicare. And most commonly, we have people that are on group health plans, and now they're finally retiring in their late 60s, early 70s, sometimes 80s. You have an 8-month time window when you leave the group plan. You can sign up on Medicare, and there's no penalty. Your coverage will begin the first of the month after your application. Again, there's a general enrollment period from January 1st to March 31st. Up until recently, they had you'd apply in January, and then they wouldn't start you till July. But now it's gotten better. If you apply in January, your coverage will start February 1st. And again, if you're using this period, you might be subject to a 10% late enrollment penalty, and that's 10% per year. So additional Medicare plan options. So number one is someone signs up on Medicare and they don't want anything else, but they need coverage for prescription drugs. The second is original Medicare, plus people add a Medicare supplement and a Part D prescription drug plan. And the third option is someone enrolls in a Medicare Advantage plan, where you assign your Medicare benefits to an insurance company and they become your provider of Medicare services. In all these cases, generally, you need to continue to pay your Part B as in boy premium. Prescription drugs. So in California, this year we have 26 Part D prescription drug plans. Next year, there are 23 Part D prescription drug plans, and they range in price from 40 cents a month to $188.40 a month. So that's quite a range. These are provided by insurance companies. All the plans are slightly different. They have different drugs on their formulary, different copays. We recommend shopping all the various options and seeing which one produces the lowest overall cost. Don't get hung up on the component parts of the Part D plans. So the option is to enroll in a standalone plan, or if you enroll in a Medicare Advantage plan, most of those include prescription drug coverage at no additional cost. So Medicare has Part D has a lot of moving parts. Next year, the standardized plan will have a deductible of $545, and about half the Part D plans have that deductible. Once you satisfy that by purchasing drugs at the negotiated retail price, you go into initial coverage, and you could have a copay or a percentage of the drug that you're paying. And then once you've purchased drugs, not what you pay, once you've purchased drugs with a retail price of $5,030, then you're in the coverage gap. Used to be called the donut hole. They don't like that term anymore, but I still like it. At that point, you're responsible for 25% of the negotiated rate for your prescription drugs. And then once you've hit the level where the total of the drugs you've purchased hits $8,000, again, not what you pay, but what the cost of the drugs are, then you're in catastrophic coverage. And for the first time ever, when you hit that catastrophic coverage level, your cost drops to zero. Presently, it's 5%. 5% doesn't sound like a lot unless your drug is $10,000 a month. Then it's quite a bit. So next year, we're going to have some relief. Lots of our clients are going to save money because their cost is going to drop. So a lot of people, when I explain Part D, I think this is what they're seeing or thinking or feeling. It's a lot of moving parts. It's complicated. So the best thing to do is to go on to Medicare.gov, input your drugs, and it will rank all the Part D plans or all the Medicare Advantage plans from lowest to highest in terms of the cost for Part D. It doesn't make sense to break it down and try to do it manually. I think it'd take a team of engineers 10 years using slide rules to figure out all the permutations. If you don't sign up for Part D when you turn 65 and your coverage through your group plan is not considered creditable, you'll pay a penalty. Or I have people that they sign up on a Medicare supplement plan at age 65 and I don't need a Part D plan. I'm not taking any drugs. Well, eventually most people will sign up on a Part D plan and you will have a penalty to pay of about 40 cents for every month that you didn't have coverage. Again, that doesn't sound like a lot, but I've got clients that are paying $63 a month in penalty that they'll be stuck with for the rest of their life. The scarier part is going without Part D coverage is if you get a really expensive prescription, like a cancer drug for $10,000 a month, you can't sign up. You have to wait till the open enrollment, and you will delay your enrollment till January 1st. So Medicare supplement plans, over 14 million Americans are on Medicare supplement plans. This offers the greatest flexibility and freedom to go to any Medicare contracted provider anywhere in the United States, other than doctors that are in closed systems like Kaiser, for instance. Your out-of-pocket costs can include copays, deductible, and coinsurance. There are 11 specific plans that the government has authorized. The most popular plans are G, N, and F. Right now, we're mostly enrolling people in Plan G. As of January 1st, 2020, Plan F became unavailable to anyone that was new to Medicare. Premiums vary dramatically from county to county, from state to state, and by age. If you don't sign up when you're first eligible for Medicare Part B, they can ask you health questions. And usually when people sign up on a Medicare supplement plan, they also sign up on a Part D prescription drug plan. You have to be enrolled in Medicare Part A and B to enroll. These are also called Medigap plans. And I get this question all the time. Well, I want a PPO plan. Okay, I think you want a Medicare supplement or a Medigap plan. No, I want a PPO plan. Okay, Medicare supplement plans and Medigap plans are actually better than a PPO plan because it only requires that the provider be contracted with Medicare, no requirement to be contracted with any insurance company, no involvement with any in any way with an insurance company for your health claims. So these are the specific plans that are available. Again, if you turn 65 or eligible for Medicare after January 1st, 2020, you're not available for Plan C or Plan F. But if you did turn 65 or get Medicare eligible before January 1st, 2020, you still have eligibility for Plan C and F. So we talk to a lot of people that are paying way more than they should on Medicare supplements, typically Plan F, I, or J. And we've been systematically moving our clients and other people over to a Plan G. So if you know someone that's been on a Medicare supplement plan for more than, say, 7 years and they haven't shopped it, chances are they're paying more than they should be, and it's worth taking a look. In California, we have a birthday rule which guarantees you the right to change your Medicare supplement plan every year around your birthday. No health questions, no underwriting. So Medicare Advantage plan. So if you watch any TV, you're going to see lots and lots of commercials for Medicare Advantage plan. Joe Namath is Joe Namath. I know a bunch of celebrities are hawking this. So if you go on a Medicare Advantage plan, this is covered under Medicare Part C. And you have assigned your benefits to an insurance company who then becomes your provider of Medicare services. Monthly premiums vary by plan, but we've got dozens of plans that have zero monthly premium. There's more than 100 Medicare Advantage plans sold in the Los Angeles area. Most of them cover prescription drugs, and most of them have an out-of-pocket maximum of less than $1,000. You have to be comfortable with the network that they're offering, but Facey participates in a number of these plans, as does Cedars-Sinai, UCLA, and there are dozens of other medical groups. Typically, this is guaranteed issue. So during the annual election period between now and December 7th, you can sign up on one of these plans, no health history questions, and your coverage will start as of January 1st. You cannot purchase a Medicare Advantage plan and a Medicare supplement plan. That is illegal, and it would create massive problems and claims. You do need to be enrolled in both Medicare Parts A and B. And lots of these plans cover additional benefits, and you'll see in a couple of the plans that I'm going to describe later, there's so many additional things that they add to these plans. So some people have an option to take a retiree health plan. And I'd say about 40% of the people I talk to, the retiree health plan is pretty darn good. Oftentimes there's no cost. It's a good network. There's minimal out-of-pocket cost. But I also find some that are paying ridiculous amounts for retiree plans, and they're much better off moving over to a Medicare plan. So if you know someone in that circumstance, might be something worth taking a look at. And if they're on a retiree group health plan, they're guaranteed issue to go on to a Medicare supplement plan and a Part D prescription drug plan. So our job is to help someone figure out what the optimum solution for them is based on your budget, the doctors you want to see, the drugs you're taking, what sort of care you're under, if you're traveling and staying in other states on a frequent basis, and other items. So we don't charge anything for our services. We get paid a commission from the insurance companies, and we will tell people, you know, stay with the plan you're on. We don't have anything better. We will not talk someone into something just to make a commission. So Jerry and I have to spend literally dozens of hours every year to go through training and certification to make sure we understand these and understand the protocol, things that we must do in order to do it in a compliant basis. So you get charged the exact same cost going through us as you do if you go directly to a carrier or call a toll-free number or an internet service. So Medicare enrollment periods, there's an initial enrollment period, special enrollment period, annual, and open. So the initial enrollment period for Medicare and Part D plans is the 3 months prior to the 65th birthday, the month of, and 3 months after. So it's the same as Medicare Parts A and B. For Medicare Supplement Insurance, you have a guaranteed issue from 6 months from the start of your Medicare Part B, or if you're on a group plan, you've got time from the loss of your group insurance. Special enrollment period. So the most common reason is someone comes off a group plan. But also if you're on a Medicare Advantage plan and you move out of your service area, there's a special enrollment to enroll in any other Medicare Advantage plan in the area you've relocated to, and also Medicare Supplement plan. If you've moved in or out of a long-term care facility, there's a special enrollment period. COBRA, people that have retired or their job has been eliminated and they're guaranteed the right to go on COBRA for 18 months. In many cases, the employer will pay for COBRA for part of that. And that's a problem because once you go on COBRA, COBRA becomes secondary to Medicare. So I've encountered dozens of people that have left a company, they're on COBRA, they're over age 65, they didn't sign up for Medicare. That's a problem. That's a problem because the COBRA coverage will say, we only pay after Medicare pays, but I don't have Medicare. Gee, then we don't have to pay. So I've had a number of people that have had that issue. So if you know someone on COBRA over 65, make sure they sign up for Medicare Parts A and B, or they could have a serious issue. Medicare plan open enrollment period, they might be changing the name of this, but from January 1st to March 31st, if you're already on a Medicare Advantage plan, you can make a one-time change to a different Medicare Advantage plan, or you can disenroll from a Medicare Advantage plan and go back to original Medicare and sign up on a Part D prescription drug plan. So you have more flexibility between October 15th and December 7th than you do during this period. So I ask people, do you do a yearly Medicare plan review? And if you know others that are over 65, parents, siblings, friends, and they haven't reviewed their coverage in years, they really should take some time to do it. Maybe not every single year, but we encourage our clients to take a look every year. Okay, the annual election period is what we're in right now. And Jerry and I, we equate this to tax season for accountants because between October 15th and December 7th, we've got over 2,000 existing clients that we offer to shop and review and try to make sure they're on the right Part D prescription drug plan and right Medicare Advantage plan. We utilize mymedicare.gov, and we've got a new platform that we utilize where people can input their drugs directly, and then we go in and shop for them. So when can I change from a Medicare Advantage plan to a Medicare Supplement plan? So generally the answer is there's no open enrollment for Medicare Supplement plans. I have people disappointed all the time that think, okay, yeah, I'm not happy with my Medicare Advantage plan. Let me change over to one of those Medicare Supplement plans. Well, you can only do it during an annual election period, and then it's subject typically to answering health history questions. And you can and will be turned down if they don't like what they see. So when you're first eligible for coverage, we strongly encourage you to make the right choice and look at the different options and don't listen to all the advertising on TV. So as of right now, one carrier, Blue Shield of California, is offering what they call an underwriting holiday. So between now and December 31st, if you or anyone you know are on a Medicare Advantage plan and you're dying to get on a Medicare Supplement plan, you can do so on a guaranteed basis, no health questions. You have to be in the state of California and you have to be enrolled in Medicare Part A and B. You don't even have to be enrolled in any Medicare Advantage plans. Now, the Blue Shield rates are not that terrific at some older ages, but once we get someone on a plan this way, then we can change them to a different company at their next birthday. So we utilize Medicare.gov all the time to shop for people, and you should become familiar with it as well, because you can maintain your list of drugs on here, and you can shop plans every year, and you can also do a bunch of other things, checking on your premium payment and your claims. The plan finder on Medicare.gov currently shows 74 Medicare Advantage plans available in the Los Angeles area. And I think there's about 30 special needs plans designed for people that have Medicare, Medi-Cal, or have specific health issues. You should also have received a Medicare New booklet. If you haven't, you can download one off of the internet. And this is a manual, if you will, of how to navigate your Medicare plans. You can also go to my website, pdinsure.com, and look for Medicare resources, where I've got these links. Hopefully they're all updated. I know this one says in 2019 Medicare costs, but I think if you click here, it takes you to the most current version. Hopefully we've corrected that. If you or someone you know is planning on moving out of California, we have someone moving almost every week to some other state, and we're now licensed in 22 states. They should think about their Medicare coverage before they make the move, because while they're in California, they've got some options that they may not have in the state that they move to. So if you move, you have a 60-day window to make a change. You cannot continue your Part D or your Medicare Advantage plan outside of the service area, so you're going to have to enroll in a new one of those. You can continue your Medicare Supplement plan when you move to another state, but there's a strategy involved in which plan you should be on in California, so you get the optimum value when you move to the other state. So if you can let me know as far in advance as possible that you're making a move, I can better advise you. Lots of people qualify for assistance on their cost of prescription drugs, or on even paying for their Medicare Part B as in boy. If you think you might be in that category, you should explore it. So I'm just going to give you some quick, if your income is below $22.39 as a married couple, you may be able to get some assistance in paying for your prescription drugs, or get your Part B premiums paid for. So if you know someone that's struggling with costs, then you should encourage them to contact the state agency, or you can talk to HICAP to see if you might be eligible. And then if you aren't eligible for that program, you might be eligible for low-income subsidy or extra help. The income limits are significantly higher, and that would help cover your prescription drug costs. So change is coming. Yes, Jerry.
It's 10:30.
Oh, thank you. So change is coming. So we've had a lot of changes from the Inflation Reduction Act this year. Insulins were reduced to a $35 copay under most Medicare plans, Part D plans. We were told that Part D premiums would not be increased by more than 6%. Recently, we discovered that that only applied to the base plan that no one offers. So Part D premiums are going up significantly in 2024, and maybe even more in 2025. Drug costs cannot rise more than the rate of inflation. So if they do, they have to rebate the cost back. In 2024, we calculate that no one should be spending more than $3,320 for their Part D prescription drug plan. And in 2025, there's supposed to be a limit of $2,000. And the federal government has started negotiations with the drug manufacturers of the 10 most expensive drugs. They're all suing to try to avoid that, but they all submitted paperwork to go through the negotiation process. So we'll see how that turns out. Just a quick let you know, this is the landscape of Part D prescription drug plans in California. And you can see there was some terrific rate increases on Part D plans. The average in California Part D plan went up 33% for next year. And I understand nationwide, it's about 24%. So if you want to shop your Part D prescription drug plan on Medicare.gov, I direct you to my website. I just did a video on how to shop for Part D plans for 2024. It would also work shopping for Medicare Advantage plans. If you've done everything you possibly can and you're on the best possible drug plan, the California Health Advocates has a resource brochure on some additional ways you might be able to save money. We know that GoodRx and some of the other alternative drug plans offer prices lower than some Part D plans, which doesn't make any sense, but we know that's a reality. So if you're struggling to pay the cost of prescription drugs, you might check with California Health Advocates and look at their resources. So now I'm into talking about two specific Medicare Advantage plans. The first one I'm going to talk to you about is the SCAN Classic plan. And SCAN has been around for some time. It used to be called the Senior Action Care Network. So it was an organization that was designed to help seniors. And then over time, it evolved to actually offer Medicare Advantage plans. So you can see on their plan, most services that you would be experiencing, you've got a zero copay, including no cost for hospitalization, no cost for skilled nursing, no cost for outpatient surgery. You do have a $200 copay for an ambulance ride. And the maximum out of pocket on this plan is, oh, my screen is being blocked. I think it's $299. Can you see it, Jerry?
No.
Okay. Well, that's, I can't move this.
The screen before, maybe?
No. Okay. We'll get back to you on that one. Okay. So prescription drug costs on this plan, there's no deductible, and a tier 1 or tier 2 drug would be a zero copay at a preferred pharmacy. Tier 3, they've got insulin at $25, other drugs $35, tier 4 $95, and specialty tier 33%. Select care drugs that are essential, they've got cheaper at $11. So this doesn't make a lot of sense. What we do is take your drugs and go on to mymedicare.gov and see what your cost projected for the year would be. And if you take Eliquis, Xarelto, Ernesto, Januvia, or the drugs on tier 6, SCAN is the plan for you. That's their sales pitch. You just pay $11 per month for those drugs. So that's huge for some people that are on those medications. They offer an embedded HMO dental plan, which I've not gotten a lot of feedback on. And they just recently added a new PPO dental plan. It's an additional $42 a month, but it's a very good PPO dental plan. Included with SCAN, you get vision services, transportation, acupuncture, chiropractic, hearing services, a travel assurance kit. You've got access to telehealth for urgent medical and behavioral medical, a nurse hotline 24 hours a day, 7 days a week, someone to help you figure out how to use your computer or smartphone, health tech. And then health club membership is included under Silver Sneakers. You've got an over-the-counter allowance of $125 per quarter, and it rolls over in the year. You get a free fitness tracker, and you have access to online brain games. I'm afraid of those. Okay, for the next year, SCAN has 3.5 stars. That's well within our reasonable limits of what we look for. And SCAN has some additional things like SCAN Return to Home, where they'll offer meals for someone that's been hospitalized or in a skilled nursing. You get a free emergency response system. There's also solutions for caregivers. So they offer a respite service up to 40 hours per year. So if you've got a caregiver for someone, you can get up to 40 hours per year where they'll be given a break. And you've got care coordination sessions. So this plan is loaded with all sorts of extra benefits. And this is the final information on SCAN. They used to be just in California. Now they've expanded to several other states, not the entire states, but subsections of those states. The other plan I want to talk about is from AARP United Healthcare, and it's now called the CA004P plan. I liked it when they called it the Focus plan. It was easier for me to remember. This plan has no monthly premium, no deductible. Your maximum out of pocket in a calendar year is $800. Provider office visit is a zero copay, primary care specialist or virtual. All preventative services are zero. You've got a zero copay for admission to a hospital. Skilled nursing facility, zero cost for the first 20 days. It's typically the length of time I see someone in a skilled facility, but days 21 through 100 is kind of inaccurate. You have a $100 copay until you've hit the $800 maximum in a calendar year. They offer outpatient hospital, including surgery, a zero copay. Group therapy or individual therapy or virtual therapy visits are available. Diabetic monitoring supplies are a zero copay. If you need an expensive scan or any sort of diagnostic test, lab services, x-ray, those are all zero. If you need an ambulance ride, it's only $90 copay for ground or air. And if you have an emergency visit, it's a $75. But if you're admitted to the hospital, then that will be waived. If you go to an urgent care facility, it's a $20 copay. This plan includes a routine physical once a year, routine eye exams, And if you go to their provider for glasses, it's $300 every year towards frames and contacts. Dental, they cover preventative, and the combined cost is $1,250 for preventative and comprehensive. You can go to any dentist, but if you go to a dentist that's in their network, it will go further. The money will go further. You'll get more done. There's a hearing exam and hearing aids between $99 and $1,249. Wow, that's quite a range. And they have Renew Active, which is a fitness program. I've actually found a lot of gymnasiums in this program that aren't in any other gym programs. I just had a woman the other day say she goes to yoga 3 times a week and goes to 3 different facilities, and she's just really enamored with it. This plan has routine transportation up to 24 one-way trips. It's like a free Uber or Lyft, except you have to plan it in advance. And it includes a free personal emergency response system. There is free routine foot care. There's chiropractic and acupuncture, and their over-the-counter is a $50 credit every quarter. And you can actually use their card when you're in the store, swipe their card, and if it's eligible for reimbursement, it'll cover it right there at the cash register. For prescription drugs, if it's a tier 1 or tier 2, it's a 0 copay. Tier 3 is a $35 copay. Tier 4, this box is really annoying me. There we go. Tier 4 is a $100 copay. Bring that back down. This plan has also 3.5 stars for 2024, and this just rehashes what I already went through on next year, the Part D prescription drug phases. Okay, a lot of people call me a Medicare guru because it's all I do. I have lots of agents that refer their clients to me because they're too complicated situations, or they just don't do Medicare, and I help people figure this stuff out. So we have time for a few questions if there's any at this time.
There's no questions in the Q&A section.
So this would be a time to put the questions in the chat if you have any, or raise your hand. I think we can figure that out. If Jerry and I can't, hopefully Anna can. So if you do have other questions, you're welcome to give my office a call and schedule a 15-minute no obligation appointment. I do a fair amount of pro bono work. If it's a question that can wait until after December 7th, it's not critical to the open enrollment period, then that would be better if you could wait till then, because we are going crazy. We're working 7 days a week, 12 to 14-hour days at this time of year. So waiting until a future after December 7th would be slightly better. Okay,